It's Tuesday and time to get answers to your medical questions from our TriHealth doctor on call. Joining me is OB-GYN Dr. Casandra Spreen, and today's question has to do with pregnancy and pain relief. Lindsey from Covington says, I am pregnant and I have back pain. What are some things I can do to help with the pain? All right, take it away, Dr. Spreen.
Sure. Thanks for having me. So a lot of patients have this concern during pregnancy, and it's very common. One of the top things I first recommend is that they look into a pregnancy support belt. Oftentimes they can find this on Amazon. I typically recommend something that has a strap that goes over the belly and underneath the belly. That will help support the weight of the growing uterus.
Because that's what causes the back pain to start with.
It's part of what causes it, yes. So you have increasing weight here. It's changing the patient's center of gravity a little bit as well. And so it's stressing different joints in the back that normally aren't necessarily bending that way. The other thing is that the hormones involved in pregnancy themselves soften cartilage. And that's useful when you're delivering a baby, but during the pregnancy it can cause these joints to be more mobile than they usually are, which can cause pain and strain and cause muscle spasms because the muscles aren't used to working that way.
And so what do you do about that? Nothing?
No, thankfully not. So several things. You know, we have things that are non-medical that we can try first. I really recommend prenatal massage, especially when people are getting into the third trimester.
It's a time and money thing.
It is. It totally is. But if you can find someone that's certified in prenatal massage and get in even every other week, if you're really suffering, right. Yoga, there's prenatal yoga classes. You can even go online to YouTube and search for prenatal yoga classes. You could do
a little bit of that each day. I used to do them up in the general manager's office.
Yeah,
maybe I should admit to that.
I didn't like my call room.
Whatever
so,
you got to do.
Right, exactly. So those things, just a little bit of stretching, keeping that core muscle strength in the abdomen and the lower back, you know, is going to go a long way. And if you know you're going to be getting pregnant, really strengthening those core muscles is going to help prevent a lot of this from happening.
All right, we got to get out of this, but just really fast. Can I take Tylenol and ibuprofen, which is better?
So you can always take Tylenol in pregnancy unless you have a specific reason why not that your doctor is telling you. Ibuprofen you can take for the worst pain of it if you just can't get relief. Right. But only until 28 weeks of pregnancy. And you need to talk to your doctor about doing that.
And by the way, to be clear, I am not pregnant. I'm asking for
I'm the proverbial you, right?
The days are over. Okay, thank you so much.
You're welcome. My pleasure.
And just as always, remember you check with your regular doctor. Our TriHealth experts are a good place to start, but they're not a replacement for advice from your own doctor. Send us your medical questions, and a TriHealth doctor might just answer it live on the air next Tuesday. Just look for the link at WCPO.com/doc-on-call to submit your question. We do this every Tuesday. Thanks so much.